Welcome to this episode of the Biometrics Leadership Lab podcast. I'm Amanda Cross, and my guest today is Johan Vermeulen. Johan is a clinical data leader with over 13 years of industry experience, including a decade in leadership roles. He's worked at large organizations as well as startup and mid-sized companies, giving him a well-rounded perspective. His career has grown from leading projects to leading people and to now contributing at a company-wide level. Currently a director at Metronomia Clinical Research, he is passionate about developing teams, simplifying complexity, and ensuring quality in clinical data management. Known for his structured thinking and collaborative style, he's most proud of his strong focus on people. I'm excited to talk to him about his career journey so far and the ongoing evolution of clinical data management. So Johan, welcome to the Leadership Lab podcast.
Thanks, Amanda. Great to be here.
I'm going to start this with the same way I start everybody's conversation, which is tell me how you got into clinical research in the first place.
I actually took a bit of an unexpected route. I originally wanted to study medicine, if I can start back in the day, but for various reasons that didn't work out. So I spent some time in academia, then I fulfilled the role as a criminologist, because I also did my honors in criminology, which is quite a different path from where I'm now, right? But then at the stage, life threw me a curveball, and the curveball is called retrenchment, if you wondered, and I had to rethink my direction. So back in the day, IQVIA, now Quintiles then, actually had a DM school. So I made it into that DM school. We were about 20 people, and then from that, they selected 3 to 5 people to start. So it's interesting because although I wanted to go into medicine or into the clinical and medical field, I at the end landed there just completely from a different perspective, right?
I always say everybody falls into clinical research. Very few people to purposely set out to do it. And I guess you kind of are working in a medical related field after all, supporting clinical trials.
Yeah.
So the data management as a practice and function has evolved quite a bit, probably even from when you started. So how does it compare today to when you first entered data management? What stands out to you the most?
For me, I think it changed from really just being an executing function. I'm thinking back about 2014, I started on a paper study where I knew global rulings better than what I know my children's birthdays at this point in time, because I have a lot of children. But
Johan has 4, just in case anybody's wondering.
So the main focus then was really ensuring to clean data, and it should be accurate from a data manager's standpoint, right? Where today it feels like it's really more evolved and more strategic. We as data managers are much more involved earlier in the clinical trial life cycle. We need to talk about data strategy and the broader trial design as well. So I think that changed from just actioning queries or global rulings, from having a seat. And then obviously the thing that comes up a lot at conferences and so forth is then also the change of technology and automation at this point in time.
Yeah, just to pull that thread for people who might not know, those global ruling documents back in the days of paper would tell you what you could go ahead and fix on a case report form as you entered it, and you didn't need to query the site. And that's changed quite a bit. I don't even think they exist in any form anymore. I always say the burden has just shifted entry to the sites, but since they're doing it, there's no more of those global ruling documents. But this, in terms of what a data manager is expected to do and the capabilities that they should have and the traits that they should have, I think those have adapted quite a bit as well over the last 5 to 10 years. What are your thoughts on that?
So I think from a standpoint where for data managers, it was always technical execution, whether it's the cleaning itself or the database build, or just ensuring that we meet timelines. Those are still important fundamentals, but they're not standing on their own anymore for a data manager. I think something that's an expectation now and has become stronger and stronger is communication and stakeholder engagement capabilities. I think we often forget how important that is, because in that type of collaboration, you engage with critical thinking measures and frameworks. So data management is not only actioning data management issues. The expectation now is that we proactively suggest solutions that or prevent issues that is applicable to the entire trial and not to the siloed data management anymore.
I love you brought up communication, because anybody who's ever listened to anything I have put out there in the world, communication is key to everything. So knowing who to communicate with and when to communicate with them, and to be willing to open up that communication becomes really central. And there's a lot of, I'm glad you mentioned stakeholders, because there's so many more stakeholders that a data manager has now than they might have had, 5 or 10 years ago. There's so many more data sources, so there's more vendors to work with. There's, just a lot more eyes, or they're probably working more closely with programming now or statistics, and so it becomes a lot more of who are you talking to and about what and when. Unfortunately, I didn't get to go to SCDM last year, but you were there and you made a presentation. I think it was your first one. So, is that your first one?
Yes.
There? Yeah. And you had a really interesting take on data management career progression, and you said clinical data management is not a race track; it's a journey.
Yes, indeed. I really enjoyed that presentation. It was something that I'm passionate about, and I really like to speak to people development, career development. So where that really came from is that in clinical data management, let's think about a career ladder. Just to bring the audience to the same picture, it was predictable, right? You knew CDC, data operations coordinator, lead, manager, and so forth. And you were pushing to just keep climbing that ladder. That was kind of development, where speed and upward movement was defined as success. And I must be honest today, I really think there's still a lot of people who has that mindset, feeling the pressure to move to the next level as quickly as possible. But what I wanted to carry over in that presentation is that approach can actually be limiting in today's environment. Careers are far more dynamic today, and growth does not just happen vertically. It can also be a lateral thing. There's new roles, new experiences. There's really so much options.
So we were just actually talking about that before we hopped on to record, which is that every opportunity you have is an opportunity to expand your knowledge, maybe horizontally and not so much vertically, but what opportunities you're getting now that you might not have had if you just went on a traditional vertical pathway for a data management career. So what do you think has changed in the industry that has made data management careers more of a journey than a ladder?
The first things that will come to mind, but I don't necessarily want to elaborate on them because it's the obvious ones, is the increasing complexity of clinical trials, and then also the technology change and the drive behind that. But what's not so often mentioned is the shift towards more integrated ways of working. And yes, if we're honest with ourselves, we can say that maybe the complexity and the technology drive pushed us to work together, as we don't always have all the answers in our siloed functions. But the beauty of it all is that functions and people come together now. They integrate and they collaborate. So I'm thinking of how collaboration between bios, clinical, and even to an extent some data sciences areas opened a whole new world of career paths. I remember in 2014 as data manager, my contact people as a data manager was my fellow data managers and my lead, and that was it. No engagement to any other functions or stakeholders outside of that box. So I really think at the end of the day, the big change is that people collaborate more and work more in integrated ways today.
And what an opportunity for people to develop themselves. Like, my view is the more you know about the entirety of the clinical trial process, better you will be at whatever your function is. And having an opportunity as a data manager to engage across the entirety of the clinical trial and with a wider variety of functions gives you the opportunity to start picking up that knowledge about, oh, that's what they're doing over there, or that's why stats is so worried about that, or, oh, now I really understand from the CRA much more of what's going on at the site. And it helps you do your job better because you can anticipate what you're doing in your job and how that's going to affect other people and what risks two different functions can mitigate together.
For sure, you realize the impact your function has, and also secondly, you can think about why I am doing something. It's not just I'm executing this task to get it done. You understand the bigger picture of things.
Yeah, and I like the cross-functional communication. I'm just going to cry that I use those words all the time. But it's very easy in data management or any other function to just think about your problems and risks and how to solve them in your own silo, whereas somebody else might have a super simple, efficient solution to your problem. And if you could just talk to them about what the goal is or the why behind what it is you're trying to do, you can often solve that together in a much more streamlined way. You've had a lot of time and experience as a line manager and above in your career, for one that's relatively young, I would say. So think back to your very first time you started managing somebody, because a lot of the conversations I've had with people, we've all kind of coalesced around the first time you start managing people is the hardest jump to make in your career. So I'm curious what it was like for you, what challenges you saw along the way.
I think it's a truly accurate statement. I stepped into my first line management role in 2018, and it was definitely one of the more challenging ones. Personally, I must say it was the mind shift thing, right? To move from a task-driven role where you complete something like a specifications and you send it out for authorization, a kind of checkbox activity done and dusted. And when moving into management, your success is not something necessarily you deliver. It's about what the team brings. That was definitely a difficult adjustment, and also learning to step back out of the operational details. And that's something I can honestly say for you, Amanda, and the audience, is something that I was still guilty of for quite a while in my management career. Even when I was a director, I still caught myself doing that. I caught myself doing the thinking work and the work for the team, but it took some time to really find that balance.
And that piece is what everybody says is the hardest part, because you're not actually, it's harder to figure out what is successful for you on a day. What is it you've done? When you're not ticking boxes like, I put this out for review and I did this and I got this approved. Your whole relationship to work changes from you ticking through it yourself to you enabling others to do it. I think I've seen a lot of really experienced people, and really people who've been very experienced in line management, still defaulting into like, oh, I'll just do it myself, or I'll just get it done because it's easier in a way and it's comfortable.
My big take on the role is that as manager, I had to learn to focus on where I truly add value, not where I just make someone's day easier operationally, because then actually I'm not doing my work. You said it now, but it's enabling your team, supporting them, helping them grow, and a very important factor is also helping the company to grow and evolve. Um, I think that was something I reflected on and really had to be strict but also patient with myself on this transition because it doesn't happen overnight.
I think I had a conversation about this with somebody recently. Maybe it was just, I can't remember where, but it was like they, as a member of a team, they actually didn't like when their boss or line manager said, "I'll do it," or "Give it to me and fix it," because you're taking away from the opportunity to learn and grow and understand. And it's, we're very timeline driven, especially CRO side. So it's very tempting to say, let's do it the fastest, quickest way we can, but it does really rob your team of the opportunity to learn. And I think when we were learning, we learned hands-on, making mistakes, taking a little bit longer to do it. So what would be the advice you would give somebody who is taking on their first line management role?
For me, I would really say focus on enabling your team. I think as a young line manager, that should be the focus, to move away from delivery of something, but more enabling people to optimally deliver.
One other component is, there's the first jump into the line management roles, and then there's going up those levels, right? So there's lots of titles they give first-time managers, so I'm not even going to pretend to get them right. But eventually you start knocking on that director door, and you hit into these lines of director, and you have a broader scope of responsibility, and you really are shifting from kind of just looking out for yourself or looking out for a couple of people to the decisions you're making impacting the company.
It's really an interesting one, because if I think about it, when I moved into management first, let's say line management level, the shift was quite tangible, right? We just spoke about it. It was just tasked to enabling your people. But one of the biggest shifts was really moving away from being closely connected to the detail, where I was forced to think more strategically and broadly. I will never forget this, and at that point I didn't understand it, but my line manager at that point in time, the VP, when I asked for more responsibility, I wanted to take over another team and help out in getting the structure ready and all of those things. Her words to me was, "No, I want you to be bold and creative." And I was dumbstruck by that statement. And now looking back, it was so accurate because that line manager forced me to think broader, to participate in the bigger world of the industry and not only on the team that's reporting to me, that there's a long-term direction.
It also forces you to think about how you're going to enable a positive working relationship and positive changes in a team that you don't control, right? So I will say that I will say this first because it's very. What am I trying to say? It's very easy to think if the team reports to me, then it will be under my control and it will do what I say. So first of all, that is not true. So I want people to understand, just because on paper, somebody and a whole group of people is reporting to you, you can't magically make them do what you want. You still have to work to enable change. But you have some inherent authority there. It looks a lot different when you have no inherent authority over a team and you're working to enable change in something that ultimately somebody doesn't have to listen to you about?
You spot on. I think an eye opener for me in the recent, let's say, 2 or 3 years was learning to lead through others at scale, right? Because you're not only impacting your direct team anymore. You need to focus on influence, alignment, and managing the different layers of people. Um, while also serving the people, that is important. I think something that I also had to grasp and tap into was as much as I want to serve my people, as I always say, I'm also serving the business. And that's a balance that you should always keep.
And that's a big struggle. Everybody wants their line manager to watch out for them and make their lives easy at work, and that is an important part of it. And I would never say it isn't. I used to have a boss and a mentor who used to joke all the time. He was like, they don't call it work and pay you for nothing, right? So it's not always going to be easy, but I think that the higher you go, the bigger the shift in terms of you have to balance not just what individual people want, but what is going to serve the company, which exists to obviously provide a service, but do it at a profit to pay people and make money. And so that it's hard to balance those competing needs. Tell me a little bit about how you process through thinking through those changes, right? Because you touched on it with somebody saying, no, you can't have that team. You have to think about it in a broader way. What do you do when somebody tells you that? How did you change your mindset and go forward?
My first thinking when I heard that was, okay, so I wanted to free up some time and space to invest into another team, as an example. And I had to go and sit and think, this same type of energy and time needs to be invested in what I currently have and the teams I'm currently managing. And that brought me to an interesting space where I actually went and researched on how other teams, let's use coding as an example. I also had a clinical data coding team reporting into my structure how they handled clinical data coding that is not within the dedicated EDC program. How do they drive efficiency? So it forced me into a place where I had to go and do some research on functions that I naively thought I had well under control. I can onboard something new. So that in itself was really, for me, a big lesson learned that I appreciate today, because it helped me to really keep my eyes open on what's going on around me.
So if you think about our up and coming data management leads who are moving into leadership, what opportunities and experiences would you say they should be watching out for to take advantage of in order to broaden their own perspectives?
I think that at this point in time, we have a lot more platforms and areas of knowledge sharing where leads can really see what the industry has to offer, or what is the direction of data management at this point in time. So utilize things like podcasts, like we have now, where people talk. I think I will say it if I finish my story, but I think the biggest lesson is listen. If you start actively listening, then you will learn a lot. So if you attend things like SCDM, don't just attend it and enjoy the social and fun around it, but go and be open-minded in that session and think what you can bring back to your company. Secondly, also go and to the extent to read the material that is shared on LinkedIn by different companies. Yes, you're working for company A now, but go and read companies B white paper or attend their webinar. There's really valuable things that you can learn there, and then I think the long and short of it is, Amanda, if someone that is now a lead give themselves the opportunity and exposes themselves to these type of things, it also trickles some interest in areas that's options now that you were previously not even aware of. So yes, listen, give yourself the exposure.
If you could go back in time, a little Johan starting out as a CDA, starting out your career in data management, what one piece of advice would you give yourself?
I think I'm going to put, just for my answer, I'm going to put a time point on it. So let's say little CDA Johan can start today as a CDA. I will talk to my presentation that I had at SCDM, and I would say don't rush the journey. At the beginning, we said there's a strong focus to move quickly, but you know what is really personal and tangible, what drove this perspective for me is every year I attend the Cape Town Cycle Tour. So it's a cycling event, 109 kilometers, and I did it now for about 7 years already. And every year it's personal best, time tracking, push, I need to be at this time point at this time. And in 2025, I listened to my own voice in the presentation because it was that year of the SCDM. And I told myself that go and enjoy the ride, Johan. I didn't put on my smartwatch. I listened to what my body said. And I can honestly say 2025 was my personal best. I enjoyed the scenery. I enjoyed the route. And the same goes with, I think, your career. The real value comes from the depth of experience and not necessarily the rush.
I think that's the advice I gave myself too, was to be patient. Like I answered that question when I interviewed somebody, but I was like, I would tell myself to be patient because everything works out in the time, and the opportunities and things you have to learn today will serve you well in the future. And we're so fortunate in our industry that we come to work every day and we're doing something to improve people's lives, right? I mean, we're working for patients. And so it's very tangible, the work we're doing tied to a humanitarian effort. And so enjoy it, right? Like there's a lot to learn, and it's an exciting field, and we have a great opportunity to serve our fellow humans.
Exactly. I think if I look back on my career, the two roles that I learned the most was in that moment in time, the roles that I did not like the most. But that shaped who I am today, really, and the way I think about things. It's something as simple as being a validation team lead. I know I tried to get rid of that role because I already started as a lead and I still had to execute some VTL activities on 2 paper studies. But that gave me the foundation of where query starts. It's so simple as that. That led to understanding specifications, custom reports. And yes, I didn't want it at that stage. I wanted to focus on my lead activities only, but it gave me that technical expertise. Yeah, so enjoy the journey. And if there's a pit stop, enjoy it.
Yeah, I was just thinking, the biggest lessons come from the most frustrating roles. So they're painful to live through, but they really are what catapult your career and your journey. So enjoy the growth. I'm just going to give you a plug here before we wrap up. Johan is in the midst of authoring a series of white papers, and his first one has just come out as the day we're recording this. I have no idea when this podcast drops. Maybe he'll have finished it, but today the first one has just dropped, and he's doing a clinical data management thought leadership white paper series, and the first one is Sustainable Scale, Designing People-Centered Operating Models for Complex Trials. And I think that fits exactly your mindset because you're always focused on your.
Yes, yes, thank you for sharing that. And I'm very excited about the white paper and what the whole series brings. I think it's insightful not only for the leader perspective, but for your operational data managers as well, to really understand where we are going and what the strains are, and give them more insights and understanding of if there's pain points. So yes, please look out for the series coming.
Yeah, I'll link this one in the show notes and any other ones that are out by the time those drop. Johan, thank you so much for joining me today. I really enjoyed the conversation, and I thank you for taking some time to sit and chat today.
Thanks, Amanda. Appreciate the invite. It's always enjoyable.